Hi, my name is Lily. I am a new grad RN and a recent BSN graduate. So right now, I know that a lot of people have either just started their nursing program or will be starting their nursing program. For this video, I'm going to be talking about how to study for nursing school. Just a little bit of background information on me. I graduated from an 18-month Bachelor of Science in Nursing program. For my school specifically, we had to achieve at least 90% on every single assessment that we took in order for it to be considered a pass. Through my experience, I basically learned a few general study tips that I think will really help to build a great foundation for studying for nursing school. The first thing I think that you should do, anyone should do this, is to really try to figure out and understand what your learning style is. I'm not going to go in depth with all of the specific learning styles, but I think it's really important that you figure out what kind of learning style you have, and this in itself will help you figure out how you should study for nursing school. One example is being a visual learner. I myself am a visual learner. I learn really well by seeing things written out. I like reading lectures. I like to see concept maps. I like to see models. I like to see pictures. Things like that really help me to really understand the information. I'm also a read and write learner. So one thing that I like to do is I like to actually read my textbook, which a lot of people don't like to do. I actually do like to read my textbook and I like to write out notes. They're not always super in-depth notes. Sometimes they're just really brief notes that just hit on what's very important or things that I didn't know. But reading and writing really helps me to absorb and solidify that information. Some people are auditory learners, and for example, my older sister, who was one of my mentors in nursing school, she is an auditory learner, and the way that she would study for all of her assessments would be, with permission from the professors, would be to record their lectures. After she recorded them, she would go back and listen to the recording. That helped her to learn the information. For some people, saying it out loud or hearing it spoken to them really helps to understand the information better. And then some people are kinesthetic learners, and that's more of the hands-on stuff. Just keep in mind that we are dynamic beings, so one learning style might not always work for you. I have found myself throughout the whole 18-month program, I would change how I study just kind of based on what I was learning. So for example, when you're doing things for the didactic portion, you might want to depend a little bit more on the textbooks, on the lectures, on more of the informational things. But when you're learning things like skills, learning how to do vital signs, how to start IVs, that's definitely more of a kinesthetic thing that you have to do. You can read all about a procedure, but you really won't absorb that information until you try it yourself. When you're learning skills, if your professors offer an open lab, go to as many open labs as you can or as you need to really master that skill. Practicing your vital signs and your assessments at home and practicing on your friends and family, just practicing on actual people. None of these learning styles are set. You can definitely be a person who combines different learning styles to really understand the information well. So as I said earlier, I myself, I'm a very visual learner. I'm a visual learner and I'm a read and write kind of learner, and also a kinesthetic learner, just depending on what I'm learning. So once you've figured out your learning style, the next thing that you should do is really try to figure out ways to enforce that information. This probably will stem off of what your learning style is. I think this is the point where you should start trying to diversify your resources. So like, let's say for example, the first way that you learned the information was through lecture, and then to reinforce that, you go back and you read the textbook and take your own notes. Let's say you make your own concept maps, or you can teach it to one of your classmates. So for many programs, you're going to have a required textbook, and that is always a really great resource to use. And you also have your professors, who are also likely to be really great resources to use. If you have really great professors who have like open door policies, definitely try to take advantage of your professors. They're there for you, and a lot of the times they write the test. For my school, my professors wrote the assessment themselves. So asking them questions about things that I was confused about, things that were a little more complicated to grasp, really helped me in the end, because they were the ones writing the test. They were helping to direct me to what information that I really needed to know, especially to pass that assessment. Another great thing to do is to use YouTube videos to help you to learn that information. Some of my favorite YouTubers for nursing school are RegisteredNurseRN. She has really great condensed information about specific disease processes that you're going to be learning throughout nursing school. And then she also has a website that has separate like practice questions on it that help you learn her lesson a little better. And that has really helped me a lot Another popular resource is Cathy Parks. She, I think, is a really great resource, especially if your school is using ATI. Basically any Khan Academy video, they have really great visuals and notes, really condensed notes that you can take through Khan Academy. There's a lot of great resources on YouTube, and the people on YouTube, a lot of them teach the information really well. Hearing it explained different ways with different words and different perspectives really might help you to grasp the information way better than just reading it through a textbook or just hearing it from your professor's point of view. Pull from a lot of different things to really help you solidify and reinforce the information from how you initially learned it. My next tip is to form a study group. Get in with a study group. Forming a study group will really benefit you throughout nursing school. You get a lot of the emotional support that comes with study groups and making friends, and also it comes with the knowledge support that you get from people who are studying the same things as you. They might understand a concept before you, so they can always help you if you're not understanding something, or you can help them if they're not understanding something. I just think study groups are just mutually supportive for everyone in it. There definitely are different kinds of study groups though, so really just try to find a group that you vibe with really well and that everyone kind of agrees to the same study style that you guys all have. Around the first few months of nursing school, I jumped around in different study groups, studied with different people, kind of because I just realized that the way that some people were studying just really did not suit me. For example, you can do a study group where everyone stays on the same page the whole time. Everyone goes at the same pace. You guys are all going through each specific module, each specific lesson together, and you guys don't move on until everyone understands it. You could do another kind of study group where someone is teaching you the information and then they'll ask you questions about it and then you teach it back to them. And you can do that if you have like mentors or people that you know have taken that class before. And then another kind of study group is everyone sort of does their own thing. Everybody studies independently. And then when someone has trouble with a specific question or a specific concept, then everyone comes together to help that person and you guys just help each other out whenever you need it. Those are just some examples of different kinds of study groups. And I did actually experience all of those different kinds of study groups. The one where everyone went on the same page didn't really work for me because I like to work at my own pace. The one where someone taught me and then I taught it back, I did that with my mentors who had gone through the program just the year before me. My favorite kind, and I think the most common kind of study group that I see, is individual studying and then everyone just coming together to help each other whenever you need it. When it gets closer to assessment days, with my study group, we would actually go through some of the PowerPoints. We had a course outlines and that would kind of outline the specifics of what we needed to know for this course. So we would go through all those together and we would all like input our own knowledge. And we would do practice questions. Sometimes we would answer them together or sometimes we would answer it on our own. And then if someone missed a question, we would all help to explain why we picked our specific answer, what our thought process was. You just have a lot of different minds coming together and you guys really can just help each other out. So I just think study groups will be really beneficial for nursing school especially. But really, just figure out what works best for you. Next, this is a little more specific to nursing school. I think it's very important that you really learn test-taking strategies and get familiar with what kinds of questions they're going to be asking you throughout your nursing program. Nursing assessments, in my opinion, are very different from what you are used to in your other undergrad classes. They aren't just knowledge-based questions. You really have to do a lot more with these questions in order to really be able to answer them correctly. Me and a lot of my other classmates were really just thrown off by that first assessment that we took because a lot of the questions, the way that they were asked, they were just so different from what you're used to. Learn what kind of questions they're going to ask. And some examples that they're going to ask you, your basic multiple choice questions. They're going to have select all that apply questions, and you really have to understand how to approach select all that apply questions. It'll help your thought process a lot more if you learn test-taking strategies for those things. There are a lot of subcategories for the kinds of questions that they'll ask you throughout your nursing program. Learning how to critically read and learning these test-taking strategies and learning what kinds of questions that they ask, it'll really help you with feeling more prepared for your nursing assessments. Last but not least, I have just some very little more general tips on how to study for nursing school. I would say really try to take time to understand your prerequisite courses if you have not taken them yet. They do ultimately help you throughout, your nursing program. There's a reason why they are prerequisites. And the knowledge that you learn from those prerequisite courses, they might not be glaringly obvious when you go through nursing school, but they do help set a foundation for your base knowledge. Physiology especially helps me to understand how the body works, and it helps you to understand some disease processes better. It makes you understand why a medication would create this sort of reaction in a patient, or makes you understand why, if this part of the body is malfunctioning, how it affects the rest of the body. Chemistry was really helpful for me when I was learning how to do med math, because you can use dimensional analysis. And nutrition is really a big portion of your patient education, so it might help you to, understand and pay attention to nutrition a little more. Things like microbiology, I learned how to wash my hands there. I learned about the chain of infection and things like that. It helps you to understand some of the lab draws a little more. The base knowledge that you get really helps you to form connections, and it kind of helps you predict what the patient's condition might end up being, or what the patient might need in the future. And I would say another thing to do is throughout your nursing program, just to keep reviewing. Reviewing things can be small things, like 5 review questions every day on whatever module you're learning. At the end of the week, you do like a mini quiz, and this is really this is easier for you to do, especially if you have if your school is using a program that has a question bank. Do your best to keep up with your medications, especially just reviewing them every now and then. And the same goes for labs. Keep reviewing your labs. What are your main labs? Things like medications and labs, a lot of the stuff you're gonna get like added information. I learned about lab values in my fundamentals class, but as I went through adult health, I was learning about different disease processes and about different medications and how that medication might affect this kind of lab. And then when I went into mental health, I learned about new lab values that I needed to know, and how some medications that I learned in mental health might affect my lab values that I already knew. Everyone says this, but start early and don't procrastinate if you can. Like I was a very avid procrastinator. I found that doing some of the little things, like reading my textbook before a lecture, or starting to write notes early rather than just waiting last minute, reviewing early with a lot of my classmates, that really made just the smallest things that I did to help myself not procrastinate really made the biggest difference. And not only just my stress levels, but also it goes back to being able to refresh that information. The more that you are reviewing the information, the more likely you are to remember it and to be able to apply that to your patient's case. Get proper sleep, stay hydrated, limit your caffeine intake, please. I know it took me so many cold brews and Red Bulls to stay up and study and just to get through the day, but try to keep your health in mind. If you can, get out of your house, study at school, study in the library, study at a cafe. Just try not to study inside your room, because in my experience, it's very easy to get distracted. Find ways to, de-stress and take breaks when you need them. That's all the tips that I have for now. I hope this is helpful for you at the beginning of your nursing journey, or wherever you are in your program. This is the first video in a series of videos that I'm planning to do about how to study for nursing school. I plan to make videos on how to study for pharmacology and how I approach critical thinking, so keep an eye out for that. Good luck and best of wishes to you in your nursing journey. I'll see you in my next video. Thanks for watching.